Partnered by Times Influence.
What's the emergency?
I think somebody has been stabbed in the chest in training session in police academy.
I was not close to the heart and too deep.
I've been informed it's very serious. The patient is instructed to stay still. Object is still in the body.
Thought of removing it.
Remove what?
The arrow.
Arrow?
Sorry, I thought I told you. So we were practicing the archery in the academy, and then by an accident, our instructor got hit by the arrow.
Is he conscious?
Yes, but in extreme pain. So we thought of removing it, but you know, it could have been dangerous for the doctor to do.
You did the right thing. But where is he? Where exactly the arrow pierced?
In his chest.
Sir, we are here and we'll take you to hospital as soon as possible.
Sir, can you hold on till then?
I think I can. But I'm in a lot of pain.
Has to be taken like this. We can't take risk.
Yes.
We should remove the arrow.
So we know what we're doing. Let us do this according to our protocol. The arrow will be removed only under medical surveillance. Come on, guys.
Yes.
Lift him. And I want it to be very slow because I don't want any movement in his body. Very slow. Keep it slow. Come on, guys, very slow. Slow it. We need to keep his body stable. Very slow. Harish, keep on breathing.
Careful, careful.
Hold on, Harish. Very stable, very slow, slow.
Slow.
Very slow.
Slow.
Harish, keep on breathing. Please, Harish, hold
Sir,
on.
32-year male penetrating chest injury with an arrow 30 minutes back. Bleeding but still conscious. The heart rate tachy at 130 and BP at 100 by
Slow,
70.
very slow.
And I'll just say given, but he's still in pain.
Get the ER.
Doctor,
He'll be fine, right?
please save him.
Okay, so
I was asked to stay away from him, but I can't. I didn't do it intentionally. It was not intentional. Please save him, doctor, please.
Okay, sir, please calm down. Just stay here. Let me see what's happening, okay? I'll update you soon. Don't worry.
Yeah. I was asked to leave immediately, but I couldn't. I'm at the hospital. No, I'll stay here. I'm not going anywhere else till everything is fine. Yeah.
Nurse, we need to send blood for cross match. We'll need lots of it. Dr. Varun, we can't keep him hemodynamically stable for a long period of time. We have to assess the injury.
Yes, we need to take this arrow out, but we cannot do it here. We need to book an OT. But first, we need to assess the position of the arrow and check for internal damage.
The position is delicate. We'll have to do a CT.
No, we cannot do a CT. We cannot make him lie down. That could actually be very dangerous. It could be fatal for him.
But Dr. Varun, how will any surgeon perform the surgery without actually knowing the damage? So we'll have to do a CT, right?
X-rays. Yeah. Let's do X-rays.
X-rays?
Yes, this could actually work. Let's do X-rays from multiple angles. We do not have to make him lie down. It could be done in a sitting position. We'll get to know what's going on inside, and this is actually the best shot that we have right now.
You're actually right. Nurse, do one thing. Book an OT and call Dr. Krishnamurthy and Dr. Khatri immediately. We'll have to do multiple X-rays in the sitting position. APPA, right and left lateral?
Yeah.
Doctor, we'll have to give it a best shot.
Yes, we do. Stay very still, sir. You're doing a good job, okay? Dr. Sma, come with me, please.
Is it too bad, Doctor? Tell me if it is. Just tell Rajiv to inform my family.
Even if it's not good, you don't have to worry about it right now. That will only make it worse. So just stay calm and trust us. We will do our best. You're in good hands.
It was an accident, believe me. I don't know what to do. Academy head is really angry with me. Harish sir is still in emergency. His family will be here anytime. What will I tell them? How will I face them?
Excuse me.
I'll call you back. Yes, doctor.
Are you with Mr. Harish?
Yes.
Okay, you are his?
I am his trainee, sir.
All right. So we are taking him into the OT. Have you informed the family? We need consents.
So the family is on the way. They'll gonna take some more time.
Okay.
If it's okay with you, can I give the consent?
No. Actually, the consent can only be signed by the patient or a blood relative.
But
He's still conscious, so we'll just take his consent then.
doctor, sorry. Doctor, one more thing. How he's doing? He'll be fine now. Please be frank. Don't hide anything, please. Please.
Actually, the arrow has pierced his lungs, and there might be damage to some other vital organs as well. Damage may be a lot. But the only thing that we can tell you right now is that he's in good hands, and we're doing our best. Don't panic. Let us do our job, okay? I'll inform you when I can, okay?
They are taking him into surgery. If anything happens to him, they will be able to face myself. What will I tell his family?
Dr. Simar, are you sure we can do this in the sitting position?
Yes, sir. It's very challenging, but I'll try and keep him stable.
Okay.
fine? How did this happen?
Sir, it's my fault. He was teaching me and suddenly the arrow left my hand. I don't know how. But trust me, it was not intentional. I didn't mean to hurt him.
We will decide whether it was intentional or not.
I didn't mean to hurt him. You believe me, right? I don't know how I lost the grip.
Yes, I do. It was a mistake. You did not do it on purpose.
I'm so sorry, sir. It was an accident. I didn't mean to hurt him. We were practicing and the arrow just left my hand. I don't know how. I just want him to be fine. I'm very scared. I respect your son a lot.
I know. That was not intentional. Accidents do happen. Harish is a strong man. He'll be fine soon.
It was an accident. I didn't mean to hurt him.
We'll decide that if it was intentional or not.
Please, forgive him. That was not his fault. I know. My son will be fine.
Well, it's not in my hands. Let the inquiry committee decide after listening to what Harish has to say.
So, sister, you know what you have to do? Yeah. Hey,
Yes, sir.
you go ahead. Who was in the ambulance with Harish?
Sir, Vinay and me. But what happened?
Nothing happened. He's a tough guy. I think he will make it. The procedures were successful, but he's still critical. I just wanted to appreciate the both of your efforts. You brought him here in time, kept him as still as possible, and you did not remove that arrow. That was the key point in saving his life. He would not have made it here if anyone would have tried to remove that arrow.
We just did a job, sir.
Well, you did a good job.
Thank you, sir.
Thank you, sir.
How is he doing, doctor?
The surgeon will give you more updates, but the surgery was successful. However, there is still damage in the food pipe, and there will be another surgery. Our gastrosurgeon will do the surgery and use the Vesco clips and try to repair the leak. Rajiv, it's not your fault. Please get a hold of yourself. You know it was unintentional. He's in good hands.
So, how are you feeling now?
He looks fine, sir. How are you now, Harish? May I ask you a few things?
Excuse me, sir. He's fine now, but we need to let him rest.
But this is important, doctor. I need to know how it happened.
Yes, sir. Please ask.
Well, I know the incident, Harish. I just want to know if Rajiv did intentionally hurt you because you are the strongest trainer in the academy.
No, sir. I know that arrow came out of Rajiv's bow. No one, including Rajiv, would ever try to hurt me.
So, you don't want to file any complaint against him?
No, sir. Not at all. Ultimately, intention matters. And I know that if intentions are right and something goes wrong, then that is mere an accident. Nothing else. I'm all good. I'm all fine.
I'm so sorry, sir. I was so afraid. I'm really sorry.
Don't be, Rajiv. I'm here in front of you. I'm all good. I'm all fine.
I think we should let the patient rest now.
Yes, we should. Please.
When your own immunity starts acting against your body. So autoimmune is nature's way of telling that the things meant to defend us can also hurt us, but obviously unintentionally.
Hi,
Hi.
which floor is the ICU?
ICU A or B?
I'm not sure.
Are you the relative of the patient who was brought into the emergency yesterday?
Yeah, he's my uncle. His kidney has failed.
I know. He's on dialysis on second floor. Come, I'll take you there.
Thank you.
Let's just wait for the lift. Yeah.
What a tiring day.
Looks like somebody needs appreciation to feel fresh.
Isn't that what everybody needs after working so hard? Some love and appreciation.
So let me tell you, you were good in OT. It's not that easy to work with Dr. Khatri, but you did a fine job.
But why? I mean, he's a great doctor.
You're new here. He's not as great as he seems.
What's your problem? I mean, just because he's your father and you don't like him, everything can't be bad about him.
Everything is not bad about him, Dr. Varun. He's a good doctor, but
But what?
leave it.
Just tell me, what is it? I mean, what is it that you don't approve of him? What is it that went so wrong between the two of you? Simmer, you have to let it out. You know, keeping it in is only going to make it worse. You can't leave a wound unattended. And I know deep down you care for him.
He didn't save my mother. Not because he couldn't. Instead, he chose another life. I left her to die. Just because that someone else's chances of survival were better. He didn't even attempt to save her life. How could he do this? How could he just let her go? Sometimes I wonder, how can any father do this to his child?
I can feel your pain. I understand how difficult it must have been for you going through all this. But did you ever think that maybe he knew the reality? As a doctor, he did what he was supposed to do. To save at least one life. Even if it meant letting a person you love die.
As per the new tri-tariff order, you now have the power to choose and pay only for the channels you love. To keep watching your favorite shows on Times Now, call your cable or DTH operator and get the Times movies and news pack now.
The showstoppers, the jaw droppers, the movers and shakers.
These are some of the hard facts.
The power players. All the blockbusters. All the hard hitters in one power punch.
That's awesome.
Complete your TV viewing experience with the best of Hollywood entertainment and news. Get the Times Movies and News Pack at just 13 rupees. Ask your cable or DTH provider now.
Partnered by Times Influence.